Hello friends, welcome to the next step in the process of risk management. Here we are going to see basically the risk assessment, and this risk assessment has two parts. One is risk analysis and the second one is risk evaluation. So first of all we are going to see the risk analysis. So what is meant by risk analysis? Basically risk analysis is the systematic use of available information to identify hazards, that means risk, and to estimate the risk. So basically we have to first identify here the hazards, and then we have to estimate the severity of risk, and along with severity we have to also estimate the risk probability as well as the probability of detecting the risk. So this is what we are going to do in the risk analysis. So risk analysis is about developing and understanding of the risk. So here we are going to understand what is the exact risk in the laboratory processes. So it can also be defined as the process to comprehend the nature of risk and to determine the level of the risk. So this is the definition where it implies that in the risk analysis we are going to find out we are going to analyze the nature of risk, and we are also going to determine the level of the risk. So the risk analysis basically follows risk identification and it precedes the risk evaluation. So the overall flow of the process here will be the risk identification, risk analysis, and the risk evaluation. So coming to the risk analysis process is the determining the sources, causes, and drivers of the risk. It also includes the investigating the effectiveness of existing control. So what are the existing control measures are available in the processes itself. So we have to investigate whether they are effective or not, and how much is their effectiveness of these existing controls in the processes to control the risk. The next is the analyzing possible consequences and their likelihood. So here also we are going to see, to estimate the level of risk, we are going to analyze what are the possible consequences of the risk involved in the processes and what will be the likelihood of these risk processes. In risk analysis we are also going to understand interactions and dependencies between risk. So whenever we are going to perform the risk analysis process, we are going to see the interactions of different risks in the same process and their dependencies on each other, or how they will be dependent or interrelated with each other. The next thing here we are going to see is the determining measures of risk and verifying and validating the results along with the uncertainties and sensitivity. So whatever risks are determined, we are going to measure the seriousness or the level of risk along with verifying and validating their results as well as uncertainties and sensitivity in the risk analysis process. So now how actually to perform the risk analysis in a medical laboratory, we are going to see here. So for risk analysis we need to consider two things. One is identification of hazards and the second thing is identification of potentially hazardous situations. So there are two things. One is basically the identification of hazards itself, as well as the second thing is potential hazards. So identification of hazards, first we are going to see the laboratory shall identify and document known and foreseeable hazards associated with the examination and other critical processes and their uses, that is for example potential failure modes and use errors. Hazards in both normal use, that is correct use, and foreseeable misuse and fault condition also must be addressed. The next thing is identification of potentially hazardous situations. So reasonably foreseeable sequences or combination of events that can lead to a hazardous situation shall be considered. So basically these are not the hazardous situation, but some sequences of events can lead to a hazardous situations. So this also condition must be considered, which can result in hazardous situations. It can also be recorded. We are going to see some hazard analysis technique or risk analysis technique. So there are certain risk analysis technique which can be used for the analysis of the risk in a particular area of a laboratory. Here first of all is a preliminary hazard analysis, that is PHA. Then there is a fault tree analysis, that is FTA. There is a failure mode effect analysis, that is FMEA. And finally, there is one more risk analysis technique which is called process mapping. So, preliminary hazard analysis is a technique that can be used early in the development of a process. So, whenever you are going to develop a new process, the same time at the initial stage itself, we can use the preliminary hazard analysis so that what are the inbuilt hazards in the process itself can be identified. The next is a fault tree analysis, which is especially useful early in the development stages for the identification and prioritization of the hazards and hazardous situations, as well as during the monitoring stage of for analyzing adverse events. The next is the failure mode effect analysis, which is a technique which is used to find out the effect or consequences of individual failure modes are systematically identified and addressed. It is more appropriate for a mature system, a process which is already in use but can have potential hazardous effect or potential hazardous conditions. So this failure mode effect analysis can be used for the processes which are already in place, and whenever we are going to find out the risk areas in such processes. The next step is the next technique is a process mapping technique, by which a process is broken down into individual steps for analysis. It is used together with failure mode effect analysis, which can be useful for laboratory examination processes, including the pre-examination and post-examination aspect. These are certain techniques which can be used for risk analysis. So in this video we have seen about the risk analysis technique as well as the risk analysis process. Now, before concluding this video, I would like to give some examples of hazardous situations or hazards in the medical laboratory. So in the pre-analytical or pre-examination area is incorrect test ordering by clinician, incorrect patient identification by phlebotomist or the ward nurse, risk of improper sample collection or use of improper technique while sample collection, transportation of samples can be inappropriate, sample accessioning by technician. It can also be inappropriate and can be a part of the risk in laboratory processes. Incorrect or inappropriate specimen, insufficient specimen volumes, contaminated samples, incorrect patient preparations. These are the certain areas in the pre-examination area. Then in examination areas is the unintended use of laboratory procedures. Then characteristics of examination procedure, such as diagnostic specificity. What is the diagnostic sensitivity? Measurement specificity, measurement precision, measurement bias, analytical interference, reagent stability, analyte stability, sterility of the phlebotomy services and sterility of the processing area, as well as sterility of the sample storage area, and biological reference interval. So basically these are the test specific performance characteristics of the each test. Apart from characteristics of examination procedures, quality controls, calibrations, equipment maintenance, equipment calibrations, operator trainings are the other areas where risk analysis needs to be considered. Risk in the post-examination areas include transcription error, where there is a manual transcription, if there is a interfacing through LIS, whether the LIS is properly validated or not, where the interfacing protocols are properly validated and verified or not, failure to inform critical alerts, failure to dispatch the reports on time, failure to dispatch the report to the correct person, incorrect review of the report, incorrect release of the report. These are certain risks in the post examination areas. So with this we are going to conclude this lecture on risk analysis. Thank you.